Illinois Athletic Trainers Association, and lastly, Jim Osborne, who is a PCA trainer and also a brain injury specialist, will take us home. If you hear any crazy background noise, we're experiencing some thunderstorms here in Chicago, so just bear with us. And for now, I'm going to give it over to Dr. Jeff Mayanis to get us started here.
All right, well, thank you very much. Thank you for having me here tonight. So my name is Jeff Mayanis. I am the director of our sports medicine center here at Rush for concussions. So I wanted to start with a brief introduction. If you do a YouTube search, you can actually find some great videos, unfortunately. Great in terms of graphics, but unfortunate in terms of what they show. A lot of young football players, young hockey players getting concussions. There are concussion laws now in 39 states, including the state of Illinois. Most of these are based off what's called the LISTAT law out of the state of Washington, which is the first state to enact a concussion law in honor of a middle school student who suffered a serious brain injury from a concussion. In Illinois, the law is the Protecting Our Students Act, and this includes several stipulations. The first it says is that parents and athletes must sign a concussion agreement, that student athletes must be removed from play if they're suspected of having a concussion, and that athletes must obtain written medical clearance before returning to sports. Only licensed physicians and certified athletic trainers can give that clearance. I'd like to, so this is why concussions have become more mainstream now in terms of knowledge base, because a lot more people are aware of concussions as more states are enacting laws. But let's jump back and talk about what a concussion is. A concussion is a functional disturbance in the brain. A concussion can be caused by either a direct blow to the head, or it could be caused indirectly by an impulsive force transmitted to the head, like a whiplash injury or a blast. What happens is the brain then shakes within the skull. The brain sits within a bath of cerebral spinal fluid, or special fluid that coats the brain and the spinal cord. And when there's a violent shaking of the brain, a concussion results. Remember that a concussion is impaired brain function. It's not a structural problem. It's not anatomic, meaning that if an MRI is obtained or a CT scan, they're normal. There's no abnormality there. A concussion results in clinical symptoms. We will go over those in a minute. But these symptoms usually start within the first day of getting the hit. Sometimes they start right away, and sometimes they're a little delayed by several hours. A concussion may involve or may not involve loss of consciousness. So you do not have to lose consciousness to have a concussion. In fact, most concussions, over 90% of concussions, involve no loss of consciousness at all. The symptoms usually do resolve on their own and over time, luckily within about a week or two in most cases. And I think the thing to remember is that the event is the hit or the trauma that triggered the concussion. The concussion itself is more of a process that has to evolve and then resolve, and that's the usual case for most concussions. Concussions, unfortunately, are quite common. It's estimated that up to 1 million sports-related injuries occur to the head in high school athletes every year. That 1/5 of all high school football players will get a concussion every year. And remember that almost 90% of these are probably going unreported. Are the number of concussions increasing? There was a study done in the Journal of Pediatrics, and it looked at emergency room visits for concussions between 2001 and 2006. And for ages 8 to 13, the number of concussions seen in the emergency room doubled. And for ages 14 to 19, the number increased by over 200%. So it seems, when you first look at this, that the number of concussions in young athletes are increasing. But the question could be also posed that, are we just getting better at diagnosing concussions? I think that the general awareness of what a concussion is increases, that we're going to see more concussions. And I think as parents are concerned about these things and bringing their kids in, then of course the number of concussions diagnosed increases. Also, more clinicians are now up to date on what a concussion is and how to diagnose this. So it's important then that they're going to be increasing the number that we see. We do have to keep in mind the differences between children and adults. Children, it seems, are at higher risk for developing a concussion or developing consequences, serious consequences of a concussion, and their concussions do take longer to clear than adults do. And why this is, we don't exactly know. But the brain is still developing, obviously, in children and adolescents. In fact, the brain does not finish developing until into the college years. So there may be something about the young developing brain that makes it more sensitive or susceptible to injury. Also, children are in a way kind of like bobbleheads. They have large heads on relatively weak bodies and weak necks. And so that could also create a more violent shaking of the brain when the head is struck. You know, a lot of kids play Pop Warner football or club sports, and they may not have access to good equipment. And of course, the children in general have difficulty communicating their symptoms with adults. So I think there's a lot of reasons why kids may be more sensitive and more susceptible to these injuries than adults. Remember that concussions do not just happen in football. When you look at injury rate per 1,000 exposures, and this means every time an athlete's out in a potential situation where they could get a concussion, football far and away has the highest injury rate for concussion. But it's closely followed by girls soccer, boys lacrosse and girls lacrosse, boys soccer and wrestling, and girls basketball. This is out of a recent study even in the American Journal of Sports Medicine. Part of this has to be taken into account, though, that these sports are actually sanctioned team sports. There are lots of sports, too, and that in many schools are club sports, so we may not have the same access to data that we would for these sanctioned sports. So, for example, ice hockey. When we actually look at athlete exposures for ice hockey, it has one of the highest rates of all of concussion. And even Taekwondo for girls was actually the highest risk sport. So there's not good, we don't have a good database yet mixing the club sports with sanctioned team sports to know exactly which sports are the highest risk. But I think it shows here that football, hockey, soccer, lacrosse definitely are higher risk sports than others. In fact, this is not an injury just for boys. Again, a lot of people think football, concussions, no other sports. But no, this happens, as I just showed you, in boys and girls. And in fact, there may be a higher risk for girls in some sports even than boys. Girls soccer, when compared to boys soccer, has almost 70% higher increase in concussions. And in 2003, there was actually a study done in the Journal of Athletic Training where women's soccer had the highest concussion rate of any sport that they surveyed. Girls basketball, when compared to boys basketball, 3 times higher risk. So there may be something about women's sports that may be higher risk than men. We have not figured out exactly what that is, though, yet. When we break it down as to what happens in a concussion, we know that there's different types of forces to which the brain can be exposed. Most of these are measured in G's. Linear force is measured in a force called G. So usually a cough is about 4 G's, a roller coaster ride is about 5 G's, and a concussion we think happens at around 100 G's. G means the force of gravity times the force of gravity. So it would be 100 times the force of gravity. However, this is somewhat tricky because we don't know an exact number for which concussions are truly obtained, meaning that there's really no minimum threshold that we know. It is also concerning that the newest thinking on concussion, the newest research, seems to think that it may not just be this linear force, it may be a rotational force as well. Meaning if you think of a lot of sports like football or rugby or hockey, the brain may be the head may be rotating to the side when the athlete actually gets struck. And so there may be a combination of a twisting or rotational force and a linear force that causes the concussion. This is probably the reason why most helmets designed will not help protect against the concussion, because they can help protect against the linear force, but they may not protect against the rotational force. What happens in a concussion when we break it down is that this trauma, this shaking of the brain, can create a mechanical disturbance in the brain on what we call the axons, which are part of the nerve cells, and it can change the metabolic needs of the brain. And so many different things are happening all at once after the hit that can result in concussion. How you see this and how we see this is as symptoms, what the athlete shows when they get a concussion. The most common symptom of a concussion is far and away headache. Headache accounts for probably over 90 to 95% of symptoms. So the most common symptom you're going to see is headache. That's actually followed by dizziness, trouble sleeping, mood changes, and then trouble concentrating and with memory. So I always get this question, how do I know if I had a concussion? Well, I think the bottom line is if you suffer a hit to the head or trauma and you have symptoms, some of the ones that I just mentioned, you basically have a concussion. Not every hit to the head results in a concussion. You can bump your head into a cupboard and you might see stars for a second, but 2 minutes later you're fine. So that's not a concussion. I think when you suffer the blow to the head and then you have these symptoms, whether they last for 10 minutes or last for a day or last for 2 weeks, that is a concussion. How do we diagnose a concussion? Basically, we take that history of trauma to the head and then ask you if you have some of these symptoms. If you're on the sidelines of a soccer game or basketball game or hockey match, and then we can evaluate you with a little bit more detailed examination. What the athletic trainer or the physician will do is usually give a brief test, a memory test, a balance test, a neurologic test, check out the whole neurologic system, and make sure that there's no glaring deficits or defects. In the physician, sometimes then you refer to the physician's office for a follow-up on the concussion. In the physician's office, what we may do is we might use a form called the SCAT-2, which is a way to assess a concussion using, again, more detailed memory tests, balance tests, and things like that. We complete a full neurologic examination, and we may even do what we call neuropsychological tests, which is something like an impact, headminder, Cogsport. There's different brands. It's a computerized test, a better, kind of more detailed test to compare what the brain function is actually like. Sometimes we get our colleagues involved. We might send somebody to a neurologist or a neurosurgeon or a neuropsychologist. Usually, tests like an MRI or a CT scan are not needed, but sometimes we do use them to rule out other injuries. If on the sidelines the athletic trainer or the physician is really concerned about the child because the athlete is having vomiting or persistent headache or worsening symptoms or anything like that, we may send them to the emergency room. Going to the emergency room is usually not to diagnose a concussion. We send them to the emergency room to make sure that there is not a more serious condition going on, like a brain bleed or a skull fracture. That's where they may get a test like a CT scan, but it's only to rule out these more serious conditions. The problem with a concussion is that we cannot see a concussion. It's not like this ankle twisted completely the wrong way that is easy to see from across the field. A concussion is difficult to see. So what we actually do is we rely on the athlete to tell us what their symptoms are. Interestingly enough, when there was a survey done actually in the Clinical Journal of Sports Medicine in 2004 looking at why athletes do not report concussion, the #1 reason was actually that they didn't think the injury they suffered was serious enough. And the #3 reason was that they didn't know what a concussion was. The second reason was, yes, they did not want to leave the game, which many people would actually think would be the only reason that they don't want to report. So I think this study, in a way, is actually good because it actually shows us that with education, we could get at the #1 and #3 reason, and hopefully increase the number of athletes that are reporting these concussions. Why do we care about concussions? We care about them because there's the significant things that can happen if you have a concussion. Most concussions resolve nicely within a week or two, and people can go on and live their lives. But some people develop a condition called post-concussive syndrome, or PCS. And this is where the symptoms of a concussion can last for weeks or months after an injury. The most famous example of this that a lot of people know now is Sidney Crosby. Sidney actually had a concussion and then had post-concussive syndrome, then tried to return probably too early, and then suffered a relapse of his post-concussive syndrome, and has been out of hockey for months. Unfortunately for him, but he has actually been a great way for me to show athletes the concerns that we have about concussions. So A lot of people come in and they say they don't want to end up like Sidney Crosby, and it's actually very helpful for me in teaching. Probably the most significant concern for concussions is something called second impact syndrome. And this is something that only happens in young people. In fact, there have been almost no cases over the age of 21. Everybody has been younger than the age of 21. And what this is you suffer a first concussion, and the brain is thought to be in a fragile state of healing. It needs those 7 to 10 days usually to resolve and to heal. If an athlete doesn't tell us about their symptoms and is out playing with a concussion and they suffer another trauma to the head, this can actually result in brain swelling, something that we call herniation, and brain herniation, and then death within minutes. The athlete literally can die right on the football field. Unfortunately, this is rare, but unfortunately, it's deadly almost 50 to 60% of the time, and 100% of the time, there's significant neurologic impairment. They can end up in a wheelchair, for example. And this is exactly what happened to Zachary Lystat in the state of Washington, and this is why the first concussion law was passed by the state of Washington, basically because of his case. And now many other states have followed suit. The bottom line here is that this is the reason that we don't return athletes too quickly to the football field, the basketball court, or the soccer pitch. You know, there are some effects of concussions that can happen over a while as well. Many concussion symptoms can last for a longer time, and what's interesting is the symptoms can resolve before the thinking and memory and concentration come back online. And there are actually several studies. I put 2 of them up here. But there's a study that actually looked at kids 8 to 16 and found that they had persistent deficits in processing visual stimuli up to 3 months after a concussion. And kids with multiple concussions actually ended up having lower grade point averages than controls. So there is some question as to how long these effects can last. The longest term effects that we know of is something that's very serious, and this is called chronic traumatic encephalopathy. In medicine, we call this CTE for short. And what this is a condition that is usually detected in the 40s or 50s of athletes that have had multiple concussions. And in fact, many athletes that suffered what we call subconcussive blows, which are hits to the head that may not even result in a full-blown concussion, but could take an impact over time. CTE, most people in the state of Illinois, for example, know the case of Dave Duerson, a former Chicago Bear who shot himself in the chest almost 2 years ago, this coming February. And he did it actually in the chest to save his brain so it could be donated to Boston University so they could do an autopsy on him and find out if he had CTE. And he actually did have CTE. So what this is a condition where we see a buildup of an abnormal protein called the tau protein in the brain. This is the same protein that builds up in Alzheimer's dementia. So people with Alzheimer's have the same tau protein buildup. And as of 2009, there were 52 described cases. As of now, we're up to over 60. And it can only be diagnosed on autopsy. These are some slides that show you here. These are actually slices of Dave Duerson's brain. And the dark staining that you see is actually the buildup of the tau protein. And this is an abnormal protein. The brain should look like that whitish, marbled kind of appearance that most of this brain tissue has. The dark staining that you see here is the abnormal tau protein. And the pattern is slightly different than in Alzheimer's. And there are other dissimilarities with Alzheimer's. But the bottom line is it results in a very similar pattern of dementia, depression, and aggression that we can see and loss of impulse control, the same stuff that we see in Alzheimer's. But Alzheimer's, the classic age of onset is 73. And CTE, the classic age is 45. And so this is something that strikes people in the prime of their career. The most concerning part for me personally is that we have diagnosed CTE now in even younger players. Owen Thomas, the young man on the right, was a football player at Penn State who committed suicide several years ago. His brain was sent to Boston University and analyzed, and he also was diagnosed with CTE. Austin Trenum on the left was an 18-year-old high school football player who committed suicide as well. His family donated his brain, and he also was diagnosed with CTE. So we can see this now even in the brains of high school and football players, high school and college football players who have had multiple hits to the head. Again, this is actually the slides of the actual autopsy on Austin Trenum. This is his brain. And you can again see, not to the same degree that we saw in Dave Duerson, but you can see the same staining of the tau protein, which should not be present at all in any brain at 18. I'm sorry, we covered the White Sox here, so I had to throw this slide up. Look on the bright side. For one brief, glorious moment, you forgot you were on the Cubs. But how do we manage concussion? At this point, the best management, the best treatment for concussion is rest. And when we say rest, what we mean is that the brain needs time to heal. And the best way to do that is to not tax the brain with a lot of mental activity, and to not tax the body, increase the blood pressure, increasing the blood flow to the brain through physical activity. So we mean both physical rest and mental rest. Physical rest means nothing. No sports of any kind. No weightlifting, no running, no soccer, no swimming. It's very hard for a young athlete who spends hours a day exercising to suddenly go to not exercising at all. I understand this, but again, we're trying to protect the brain here. The mental rest can mean lots of different things. It really depends on the athlete, and I really use personally an individualized approach, meaning I take every athlete differently and decide how much rest they should have. It might mean time off school, or it might just mean shortened work day at school, or a reduced workload at school. We might have them do homework but no tests. They might have to be out of everything for a little while. The bottom line is we will play it by ear, plan it according to the individualized athlete, and the key is really communicating with the school. One thing, now if you think the athlete doesn't already despise me for everything I've told them that they couldn't do, wait till when I tell them that really studies show that they shouldn't be texting, they shouldn't be on Facebook, they shouldn't be playing video games, they shouldn't be watching violent or explosive movies, and they shouldn't be on the TV all the time. So, but these are all things that can honestly worsen the symptoms in a concussion. And, you know, one of the things, too, is that they should avoid driving, as a lot of times they can have balance issues, they can have photophobia, meaning they don't like bright lights and things like that. Sometimes we do what we mentioned before, which is called neuropsychologic testing. And again, there's a couple ways to do this. One is through the old-fashioned pen and paper way. We send them to a neuropsychologist, and they spend 6 hours with a battery of memory tests. But another way is now through a computerized test. I mentioned before that there are many brands for this. A lot of schools and colleges now use these tests. I don't believe that they are the end-all, be-all of concussion management, but I do think they are helpful, especially if the athlete has had a baseline test, that we can then compare their post-concussion, so after a concussion, the results to what they had at their baseline. And we can actually follow those results over a course of time and see that their symptoms are resolving. How do you know it's safe to return the athlete to sport again? Well, the bottom line is there are some definite criteria that most colleges, universities, FIFA for soccer, the Olympic Committee, and now, thankfully, the NHL and NFL, as well as the NCAA, are all following. The bottom line is this. The athlete has to have no symptoms of a concussion at rest. They have to have no symptoms of concussion with exercise. They have to have a normal neurologic examination. They have to be off medications, meaning they can't be masking their symptoms with Motrin, Advil, so Tylenol, acetaminophen, or ibuprofen. And if they did do neurologic testing, that testing has to be back to baseline. We follow what we call a graded return protocol. And what this means is gradually increasing the activity over about 4 to 5 days and making sure that at each step they're able to handle that without having symptoms. It takes a minimum of 4 days to progress through all steps. And if they have symptoms at any one stage, they have to rest for a day and then try to repeat that step. It may take longer than this to go through this, especially for younger kids. I've extended out the protocol up to 2 weeks or longer for kids that are 6 or 8 and have a concussion. And And the reason is because we need to be more prudent the younger you are, and we have to act on the side of safety when it comes to the brain. The old adage of you have a grade 1 concussion or a grade 2 concussion and you're out for a week no longer applies. If a doctor tells you that, that doctor is not up to date with concussion management. Nobody has been grading concussions for over 10 years now. So that doctor needs to be up to date on their concussion management. All the time we need to make sure their concussions are resolved at rest, and then we put them through this graded return protocol to make sure that they're okay before we return them back to full sport. Well, how do we prevent concussions? That would be the best if we could just stop these things from happening. Unfortunately, at this point, there's no good prevention. Helmets have been studied. Helmets have gotten to be very expensive. We can spend hundreds of dollars on high-priced helmets, and they do a great job at stopping brain bleeds and skull fractures. But as of yet, not a single study has shown a decrease in concussion incidents from sports like football, hockey, or baseball. Now, helmets in skiing and biking have been shown to decrease head injuries. But again, at this point, no helmet is 100% protective against a concussion. Mouth guards have also not been shown to prevent any concussion. Mouth guards do prevent dental injuries. So if you don't want your front teeth knocked out, probably a good idea to wear a mouth guard. But the fact that a mouth guard could prevent a concussion makes really no sense. The only way that it could prevent a concussion is if the force came up through the jaw, and then it might decrease the force a little bit. But otherwise, there's no way that a mouth guard will prevent a concussion. So again, that's another trick that a lot of websites are using to lure you into buying an expensive mouth guard, but it's not going to help prevent a concussion. One thing that is on the horizon and may help is neck and shoulder strengthening. There have been a couple studies, mostly in animals, that looked at neck size and strength and show a decrease in concussion effects. And there's one study in college football players that also showed a reduction in concussion incidents when they put them through a neck and shoulder strengthening program. There are more studies ongoing, including one that we're doing now at Rush here in Chicago, to look at this. And so this may be something that can help prevent some concussions in the future. The bottom line at this point is it can't hurt you, and it can only help you. So incorporating some neck and shoulder strengthening into your routine may be a good thing to do. The real key to preventing a concussion is education. Webinars like this, seminars, talking with coaches, having coaches and parents and athletes updated on concussion. The concussion laws are helping because they're helping dispense general awareness of what concussions are. And there's plenty of websites out there, including StopSportsInjuries.org and the CDC site through the government that actually has great resources for concussions. So I really would encourage people to go to these websites and read about what they have, because this is another way to just improve your knowledge base. At our website at www.rushortho.com, you can also find a link to a lot of these websites and some more information. So I'd like to thank you for having me here today. I'd like to turn it over to Mike Overturf, who is the president of the Illinois Athletic Trainers Association, and he's going to talk to you briefly about other things that our athletic trainers can do with concussions.
Perfect. Thank you, Dr. Mianis, and I'd like to thank everyone with Midwest Rush for allowing us to be a part of this. I was very excited to hear about this webinar going on and the education that can take behind it. As Dr. Mianis mentioned, education really is the key component here when it comes to awareness of concussions. And for us as athletic trainers, obviously playing a key front when it comes to concussion management and playing a key factor in the role. We're very excited to be a part of this. So a little bit of history behind the Illinois Athletic Trainers Association before getting into it. We're a 1,600-member association group made up of certified athletic trainers, students going through accredited programs at colleges and universities, as well as honorary and retired members of athletic trainers in the state of Illinois. So why do we look at utilizing athletic trainers? What type of role do the athletic trainers play in the concussion management? Athletic trainers are trained in recognizing signs and symptoms with concussions, evaluation and diagnostic testing of head injuries, and really knowing the athletic trainers spend day in and day out with the athletes, whether in a high school, college, professional, club, youth organization, whatever it is, they're really able to identify subtle signs and symptoms of concussions just due to the regular interactions and being able to pick up on little minor changes that may be noted in someone's behavior, somehow there's some way they're interacting, the way they work, sleep, the ability to concentrate. These are big ways that athletic trainers can play a role within this. In 2010, there was a study done that showed 2/3 of parents of middle and high school athletes supported the requirements of having an athletic trainer on the sideline. One reason behind the study was actually looking at concussion management as well. The sad part about this, unfortunately, is that there was only 42% of the nation's high schools had access to an athletic trainer, and therefore the ability to have a medically trained person on site to identify and work through concussions was obviously limited within that factor. So again, what does the athletic trainer's role come into when looking at concussions management? As Dr. Mianis talked about earlier, the baseline testing, IMPACT is a great example of that. There are a number of other tests out there with that. Being able to set someone up with an objective measure when it comes to what is their brain function looking like prior to injury. Injury screening tools, the BEST test, the graded symptom checklist, again, different things that can be done on the sideline when someone does sustain some type of head injury. That can go a long way in identifying whether someone does have a true concussion when it comes to an injury. Referral to the appropriate physician. Again, this is something that you're seeing more and more physicians really start to get specialized with wanting to look at concussion management. There are a number of specialties out there when it comes to physicians, and being able to identify the accurate person for that will definitely go a long way in ensuring that your son or daughter is taking care of it in the right direction. Vestibular rehabilitation is something that's recently kind of new and upcoming. As Dr. Mianis noted earlier, rest is the biggest part of the overcoming a concussion, and vestibular rehabilitation is something that's recently been notified for those athletes that are having extended symptoms and more along a balance component to it, whereas they are working with athletic trainers, physical therapists, things along that route, to work with the cognitive function vestibular side to get them back to where they want to be quicker. Again, athletic trainers are closely able to monitor and initiate return-to-play protocols. Again, through their regular interactions, they're able to see where the athletes are coming from when they are at that point, when they're getting to the return-to-play without having signs and symptoms of concussion, and getting them back there on the field. Another long for athletic trainers is ensuring safe equipment and conditions. Again, when looking at helmets, shoulder pads, different equipment that athletes are utilizing, athletic trainers know the knowledge base of how they should be fitted, the upkeep of them, how they can be reconditioned, things along those lines. And having the athletic trainer play a role in that will definitely ensure that we put the athletes in the best case opportunity without being prone to the injuries. As Dr. Mianis noted earlier, there are some number of resources out there. National Athletic Trainers Association website is just www.nata.org. They have some great concussive resources available on there. The Illinois High School Association website has the protocol, the policy that the IHSA has come up with. As Dr. Mianis noted, with the concussion law that was passed in Illinois last year, the IHSA has some wonderful resources available to you through that. NCAA as well has some good concussion resources, and the CDC, I would echo Dr. Mianis' recommendation with looking at the CDC from that end too. And lastly, any certified athletic trainer would be a phenomenal resource for you with our knowledge base of concussions, the management of concussions, and looking at getting the athletes on a return to play of where they want to be. And with that said, I'm going to turn it over to Jim Osborne with Positive Coaching Alliance.
Thank you, Mike, and thanks everyone for involving PCA in this important program. On the slide I have in front of you on education coming up, I just want to speak briefly on the partnership among parents, coaches, health professionals, athletes, and school personnel. But I mostly want to reinforce and put an emphasis on parents as the gatekeeper or goalie, last line of defense in all of this. It's very, very important. If we look at the next slide for prevention, basically what I'm looking at here, what we can do as coaches to improve the odds of preventing a concussion. And as was mentioned by Mike and Dr. Medianis too, proper equipment and fit is important. But I think coaches also have to really look at safe and appropriate practice drills, especially developmentally, as well as looking at the types of drills. Give an example here, tackling in football, or trying to emphasize using feet first rather than heading. I remember as a basketball coach, we used to do taking a charge in basketball as a practice drill, which obviously in those days we were more worried about someone falling back and breaking their wrist and not really thinking too much about maybe that slight little tap they might make on the court. But just having the proper practice techniques and drills are really important, and reinforcing rules that are meant to prevent injury. Surveying the practice field for safety. All these things are important and are going to increase the odds of concussion prevention. Looking at identifying symptoms, Dr. Julia Harbar-Cooper's survey, Children's Healthcare of Atlanta, she found when she surveyed a high school that 91% of the coaches could ID symptoms of a concussion. 72% of the athletes could ID symptoms of a concussion, and 91% of the athletes told parents they had symptoms of a concussion but not their coach. It's really good to look at this as a connection to Dr. Medianis' slide talking about 85% of unreported concussions. It's important that parents communicate with their kids and talk to them. As an aside to this too, it's in Atlanta where this survey was done, and actually in the state of Georgia, less than 20% of the high schools in Georgia have access to a trainer. So that kind of goes along with what Mike was just saying. Looking at communication is really important. Again, parents are the key here. You need to be observant during the recovery phase. Everything that's been talked about tonight, you know your child best. If you notice that they're more agitated, they're sensitive to light, their balance is off, you're going to notice those things. They're probably not always going to be truthful in telling you. They want to get back to play. All right? And you don't want to be asking questions that are going to get one-word answers. How do you feel today? You're probably going to get an answer like good. So you want to be as specific as possible. So ask the right questions. Be specific based upon what you see, because you know your child best. Also, include school staff in concussion education and understanding the recovery process. Getting back to school too early can delay recovery. So again, parents really are the key there. And in closing, at the end here, what would you do? This is something I just want you to look at as a takeaway. And given what you've learned tonight, think about what your response to this situation would be. And in this particular scenario, a child may be really anxious to play in a showcase. Maybe they were injured playing sports for their high school team. This is one of those unregulated situations where I believe the parent really needs to step in and say, you know, you really shouldn't do this. As important it might be to you to be in the showcase and be seen by college coaches, you're not ready to go back. So it's really important to have that communication piece. So again, think about that, and thanks everyone for letting us participate, and this has been a great opportunity.
I want to thank everybody for joining us tonight. Don't go anywhere because we still have lots of information to give to you. We're going to do a little Q&A session here, and before we get to that, here's just some more resources for you. The free concussion guide at www.rushortho.com, and then you can just click on the concussion guide there to get all the information. For those of you that are in the Chicago area, there will actually be some seminars that you can attend in person, featuring a former Chicago Bear, Hunter Hillenmeyer, who was forced to retire early because of concussions, as well as Rush Sports Medicine Injury Specialist. So those are the dates and times. Feel free to contact us if you are interested in attending those seminars in person if you are in the Chicago area. And at this time, what we would like to do is open this up to Q&A session. If you have any questions in the audience, feel free to write them into the chat. We've already gotten a bunch during the webinar, so I'm going to hand it back over to the doctors, and they're going to go through some questions that they've received.
All right, so one question that I got in was, when should my child go to the emergency room? So I think this is a great question. I didn't really address this in detail. You know, I think if your child has a hit during a game or a practice, and they're either coming to the sidelines or they come home after the practice, there are some definite things that you need to look out for. The first thing would be, so the common symptoms of concussion I put up there: headache, dizziness, sometimes they get nausea, they may throw up. Usually they feel very sleepy and they want to sleep. And then sometimes, of course, there's some confusion, memory difficulties, etc. The things that you want to look out for are any signs that could be signs of a worsening injury or a worse injury at that time, but it may not be apparent at that time, so like a brain bleed. So those symptoms would be headache that's gradually just getting worse and worse and worse. So like they, you know, are saying it's basically like the worst headache ever. They're really out of sorts. It's always better to err on the side of safety and take them in for that. Vomiting, especially vomiting that becomes persistent and they don't stop throwing up. That would be another thing to take them in for. If they look like they're really getting worse off in terms of how mentally alert they are, so they're becoming more out of it, more sleepy and lethargic, where you can't even keep them awake, those are some times that you would definitely want to bring them into the emergency room for. You know, I think all the time, parents, especially you mothers out there, there's something called mother's intuition, and it's there for a reason. You know, parents have an intuition. You know your child best. Listen, if they're not acting right and you're concerned, you should take them into the emergency room. It's better to be safe than sorry. So, you know, I would watch them closely for that first day. If they're acting fairly normal and they've got a headache, I also don't think you need to go in there every hour with a flashlight and shine it in their eyes and wake them up. I think use your gestalt feeling on it, but I would, you know, maybe wake them up once in the middle of the night, make sure they're doing okay, let them go back to sleep. Remember that in a concussion, it is normal to be a little more sleepy than normal, to sleep longer that next day. That's all okay. In fact, their brain needs that rest, so it's good. But again, the symptoms to look out for were the ones that I went through, and just, you know, believe your own intuition, because if you're concerned, you should probably take them in to be examined. I'm going to turn it over. Mike has a question here for him.
One of the questions I got was, do you like Impact Concussion software or another brand? You know, there are multiple brands out there right now. I believe, personally, the Impact one is probably the most recognizable brand out there. It's been around for a number of years, was created out in Pittsburgh, and like I said, is most recognizable from people, physician side. Again, I think each one out there has positives to it. The most important thing, as Dr. Mianis mentioned about it earlier too, is having something objective to go off of. With the Impact software, it's been around for a number of years. There's been a lot of questions about, can athletes, for lack of a better term, dummy it down or juke out the test in making it a poor score initially, so that way when they have a concussion, they're actually scoring easier. It's easier to score or better on it. And because it's been around for a number of years, you know, there is actually a good history that people can go off of, that even if individuals don't have a baseline, they can take an impact test and have something cognitive or something objective to measure against based upon what sport they're playing, their age, their height, their weight. So, again, personally, I don't have a preference with it. Impact, I think, is the most recognizable, probably the most widely utilized. But again, I think the most important part behind it is having something objective to be able to measure when looking at the return to play.
We did get a question for you, Jim. What is the coach's biggest challenge with regard to concussion?
Well, I think that, again, the biggest challenge is really being able to ask the right questions, really knowing and understanding what the possible symptoms could be, and really enforcing and having them sit out and making sure that you're observing them every 10 minutes, every 20 minutes, and repeating some of the same questions to see what kind of responses you get. I think that that's important. It's always much safer to sit it out when you're, as they say, sit it out when you're in doubt.
Yep. Another question that I got here was, how long should my son rest after a concussion? So, another great question. I think the bottom line is, again, if a doctor, in the emergency room or whatnot tells you that's a grade 1 concussion, he needs to be out for a week and then goes back to football, I mean, just bear in mind that we have not graded concussions like that for over 10 years. So that is not the answer anymore. The answer really to that question is when your son stops having symptoms. So when your son is no longer having a headache or dizziness or any of those classic concussion symptoms, then it may be time that he could go back and play football. But again, as I was trying to point out, he needs to be asymptomatic, no symptoms at rest, and no symptoms with increasing activity. So that would be the time to talk with the trainer or the coach or a physician about setting him on that graded return to play, so that over about 4 days we can increase his activities and make sure that he still is staying symptom-free. Only when he's symptom-free at rest and with exercise is it safe for him to go back and play again. You got another one?
Another question I got was, do athletic trainers tend to be over-conservative or under-conservative regarding concussions? I think in this day of age, it's more along our lines to be almost overly conservative when it comes to concussion management. Obviously, being in the forefront of the news and the headlines, it's out in the news on a daily, a weekly basis, and ensuring that ultimately these, in the youth sports, they have a long life ahead of them. And if this is something where we are rushing people back too quickly, there are some traumatic effects that can have on an individual's lifestyle as they become into an adult, by potentially rushing someone back to play in a game, a championship game. In the NFL, there was the Colt McCoy incident this past year, and looking at how was it rushing someone back too quickly, and the effects that had with that, and how it played into what the NFL wants to do with their concussion management now too. So ultimately, I think it comes down to ensuring it's all about the athlete, ensuring that they are safe, and by having or utilizing the physicians to be a support to you, using your objective testing. There are multiple tools out there to ensure that the athlete is at a point of return where they are going to be safe and not do further harm to them.
Another one that I got here, which is, I think, so 2 questions. One is, where do I learn about neck strengthening exercises? So if you happen to be lucky enough to live in the Chicago area, hopefully you have an umbrella today, but also if you're lucky enough to live here, we will be having a couple of seminars, which were actually put on the screen a little bit ago, and we're going to have athletic trainers at these seminars that will be going through some of these neck strengthening exercises for you. If you don't live in Chicago, I will be happy to put on our website in this next week some examples also of some of these neck strengthening exercises. And I would just ask you to check back at that www.rushortho.com website, and we'll definitely have a link there so that you can see some of these exercises. They're really not tricky or hard. They're really kind of simple ones that just use your own body strength to kind of strengthen the neck muscles. And remember that it takes time to build up the strength of the neck muscles. Again, this isn't an end-all, be-all. Like, this isn't 100% against protecting against a concussion. But as I said before, my philosophy on it is they're not going to hurt you. It's only going to help you to strengthen your neck muscles in general anyway, and it may help against a concussion. The other question that I got, which is a great concussion, and I get this concussion question, and I get this all the time, is how many concussions are okay before my child should quit that sport? This is such a difficult question to answer. There is no right answer to this question. Unfortunately, we just don't know enough to say this number of concussions is too many concussions. And I think it makes sense when you think about every potential hit to the head is different. Every athlete is different. Different head shape, different neck strength, different things like that. Every trauma is different. So there's not a clear-cut answer as to how, and even the force of that trauma is different. So it's not, there's no clear-cut answer saying this number is too many or not. I think if you asked 100 different physicians, you'd probably get 100 different answers. However, I think that talking with other concussion experts around the country with the job that I do, I feel like most people start to feel uncomfortable at around 5 to 6 concussions. But having said that, I know athletes that have had more and are fine, and I know athletes that have had less that I've told them they probably shouldn't go back to sport again. So what matters to me more than a sheer number is the pattern of these concussions. I am more concerned about a kid that has 2 concussions and his symptoms lasting for months from each concussion than a kid who has had 7 concussions and they all seem to be fairly mild and resolved within a week with no lingering effects. So to be honest, I'd hold that kid out after 2 concussions, but maybe not that kid out after 7. So what matters to me more is the pattern that is forming with these concussions. More serious concussions over time, especially with less and less force or trauma, worries me a lot more than a sheer cutoff as a number of concussions. So I don't know if Mike, you have a different answer, or Jim, you have.
Yeah, no, I would agree with you 100%. I think it really comes down to ensuring that people are returning and taking care of themselves and coming back safely prior to the return to play, and potentially not exposing themselves to the post-concussive and second impact type syndromes. I mean, again, this is something that hasn't been studied, but looking at what have some of these professional or even high school athletes, how many concussions have they truly had? And as we continue to be educated and more awareness made about this, I think that answer may potentially come out within the next 10, 20 years, but it's going to take more time to really get clean on that. But, yep. So one question was, how expensive is baseline testing and who usually provides it? That's a great question to ask there, and again, it really comes down to what test is being utilized with it. There are a number of high schools that have purchased this program to utilize for their athletic staff or their athletic athletes. I'm sorry, to where they'll come in prior to the season to get their baseline testing done, and as being a part of the athletic program at their school, there has not been associated costs with it. There is a number of other entities out there. Dick's Sporting Goods has a baseline testing program they're doing right now for youth sports. It comes as a free of charge with it. Others that have done it, I've seen price ranges go anywhere from $5 a test upwards of $20 to $50 a test. It really is going to come down to who is providing the test, how are they going to manage it, and more importantly, how are they going to deal with an athlete when they've sustained a concussion. What is that follow-up test going to look like? Is there going to be additional associated charge with it? Is it a one-time flat fee? It is really, I guess, all over the board with that. And I would encourage you, for those of you that have sons or daughters that are in the high schools or in the youth sports, would be to have a conversation with the athletic trainer on site or the club contact to see if they have something in place regarding baseline testing and how they go about managing that and offering that to their sons or daughters.
I had a question here. Thoughts on chiropractic or massage therapy regarding concussion? I mean, I think that's a good question. Neck pain is a symptom of concussion as well that I didn't mention here, but it's actually fairly common for them to have some neck pain with a concussion. I think massage therapy could be helpful for that. And, I think a chiropractic evaluation, if you wanted to have one, and if they could do some light massage, would be fine as well, to be honest. I would not probably recommend a large adjustment of the cervical spine during a concussion. That extra motion on the spine could actually worsen symptoms for some kids. And then the other thing is that a lot of kids or teenagers can have balance and dizziness issues with a concussion, and I think if there's a lot of adjustment or manipulation of the cervical spine, that could actually worsen those symptoms as well. So I'm not really opposed, but there isn't any good research out there that shows that either one of them will speed up the recovery of a concussion or even help at all with the recovery of a concussion. Another question that I got was, where do I find a list of states with concussion laws? Great question. Even for my talk, it was difficult to come up with a list of states because you basically have to check each state, so it's very time-consuming. The CDC website actually does have some information on states and their laws, but it's really difficult. What I would recommend doing is actually looking up in your own state. Usually you can find it on your state government site. You can find a list of bills or laws that have been passed, and you can actually scan that to find out how it applies to you in your own state.
I would even add into there, you could probably jump on the NATA, the National Athletic Training website, they have a list of the states that have passed concussions as well too. So.
But even then, it's hard to keep up because a lot of states are passing them and they're quick. But yeah, that's another good resource. Exactly.
Jim, maybe one question for you was, how often would helmets need to be reconditioned?
I'm sorry, was that for me?
Yeah, sorry.
Oh, how often would helmets have to be reconditioned? I mean, obviously you'd have to check all the padding inside, make sure that they're not loose, make sure that it's snug fitting. I know that we've done a lot with the Council on Brain Injury. We've done a lot of actually fitting of bike helmets for kids, and one of our organizers would actually pull their car over, and if they saw a kid riding a bike without a helmet, she had a trunk full of helmets, would hand them out. But yeah, definitely look at the padding inside, make sure it's not coming apart or separating, and it's a snug fit.
Excellent. One of the other questions I got was, is there a big difference in having an athletic trainer versus an EMT on the sideline? It's a great question, and obviously my viewpoint may be a little bit biased coming from the athletic trainer side. I think there is a marked difference, though. The athletic trainer has the ability to identify a number of both acute and chronic injuries and the management of that, as well as the concussions, and management of emergency injuries. If there's something that is emergent that would require EMT, the athletic trainer, obviously would make that call for it. But if it's something that does not require that, the athletic trainer is obviously able to manage and handle that. Specifically when it comes to concussions, when you break down the law, is that the athletic trainers would have the ability to clear an athlete, obviously through the work and their coordination with the physician as well, whereas the EMT necessarily would not have that. So I think there are marked differences and advantages of having an athletic trainer, and please don't, if there's any EMTs out there, I hope I don't offend you with any of this. There are marked differences, though, in looking at the gameplay and the ability to manage injuries on the sideline, with ensuring that athletes have the potential ability to stay within a game, or if they need to be pulled out, then the athletic trainer should be able to identify that.
We actually have gotten a ton of great questions, and we have more here that I'm afraid that we're not going to be able to get to. But I would like to tell people that if you do have a question that we did not get to tonight, to please go to the Ask the Doctor section on our website at www.rushortho.com. And please pose the questions that we didn't get to tonight, because we're looking through them now, and there are a lot of great questions out there, and we'd love to be able to answer those for you, or at least chime in on our thoughts. So again, just go to rushortho.com. There's an Ask the Doctor section, and you can pose your question there, and we'll get back to you with our response. So.
Once again, we want to thank everybody for attending tonight's webinar. We hope this was helpful. We know the summer is ending here, and schools are getting back into action. You have pretty much every other sport with football and soccer and lacrosse coming up. So a lot of sports coming up here, getting started. So we want to make sure that most importantly, all kids out there are having the best experience, both from a positive standpoint, but also from a health standpoint. So we hope this was helpful. On your screen, you see how you can stay connected via social media on Twitter with a couple of these organizations: Positive Coaching Alliance, Midwest Orthopedics, Sports Safety, Stop Sports Injuries. If you have any other questions, we will have this webinar recorded, and it'll be up on the Positive Coaching Alliance website. We'll also link to the Midwest Orthopedics site as well. So any other questions you have, please send them our way. Thanks for joining us, and have a great evening, and enjoy the rest of your summer and the start of your sports season.